Hey guys, so I've been getting a lot of questions about this lately, so I just wanted to make a little video. And one thing that I get asked most frequently by parents about kids is teeth grinding. Um, and I feel like it's one of those things that I was pretty miseducated on, I think, but that was just kind of what we understood it to be at the time. Back when I was in dental school, was that we were told that kids grinding their teeth is just kind of, they're getting a lot of new teeth developing and growing in there, and so um, it's almost like massage, right? Like they're kind of like relieving that pressure a little bit as teeth are growing in and developing, and that it's something that they'll just grow out of and it'll be fine. Um, However, probably one of the hottest researched and kind of newest things that we understand in dentistry is it's actually most commonly in kids an airway problem, almost like sleep apnea in adults. Kind of the same thing, that they're, if they're doing it during the day while they're awake, it could be just, yeah, they're teething, and that's not as big of a deal. But if you hear them grinding their teeth while they're sleeping, they're stressed because they're not getting good oxygen, and something that not a lot of dentists are comfortable kind of diagnosing and figuring out. There are some that do, and I will link some of the offices that I know are on top of this here in our area and in the Salt Lake area. But yeah, it's a really important thing, and something that if your kids are frequently waking up really tired, if they're restless when they're sleeping, and then they're not waking up with a lot of energy, it can make a big difference. Now, what do you do about it, right? There's a couple different things you can do. There's, depending on how old they are, right? Sometimes taking out tonsils and adenoids is sufficient, and it opens their airway enough to where they can breathe better, and problem solved. Other times it requires more of like um, something to expand the palate and the airway. And there's different devices that can be made and used to do that. And other times, to be honest, it is something they will grow out of it. As they grow and their palate expands and their mouth just gets bigger, their airway is going to be more open. And but yeah, if you notice that in your kids, mention it to your dentist and see if there's any kind of an airway dentist in your area. I know of some, but not it's not very common. But it is an important thing, and really a life changing and potentially a life saving thing for your kids. So important stuff. Just thought I'd share.